There's a little bit of tension. I'm gonna go, how's that at the occiput? A little more tender there? There we go. So I'm feeling with my thumbs, trying to find a spot where there's some tension. She has a little more at the suboccipitals. I'm gonna bring a thumb in. How's that right there, Kristen?
Good.
Good? Okay. Now, my thumb would get tired, so I'm gonna reinforce with my other thumb. I'm gonna hook the thumb in, and then using my other thumb, I'm gonna reinforce to take the pressure off, to be able to distribute it through 2 fingers instead of 1. Let's see if I can, right there. How's that? There we go. This will allow me to hold this just a little bit more. It's an interesting position to be able to work the neck from. Gives us some additional options we don't have in prone or supine. If you're a massage therapist who's not using side lying, one, you can check out the mat work we do here in phase 2 on the DVD. And you can also check out the table tie workbook and DVD set where I go into more detail about side lying on a table. Right there, Kristen. Now, if I, holding that tissue right there at the suboccipitals, if I go lateral or medial, which one do you like more?
Lateral.
More lateral? Right there? There we go. Always asking for feedback helps give me a little bit more connection into Kristen's nervous system as we work. It also makes her feel that we're working together effectively. I'm gonna slowly release. You could do that with any of the muscles in the posterior cervical spine. Just make sure to get feedback from the person you work on. Here is exposed right to us. And I'm gonna come in and start to access. You'll notice this foot movement just from that little bit of pressure. I'm just using the back of my hand to very gently knead, and I'm checking Kristen's eyes just to make sure there's not too much pressure. How's that right there, Kristen?
Good.
Not too much?
Edge.
Edge, okay, I'm gonna back off just a hair, better there. Now, to be able to access this, in addition to leaving this pressure here, I'm gonna slowly, with the ball of her foot right here, give a little bit of length. Is that too much?
No, it's good.
There we go. Sometimes these little pin and stretch movements feel really nice right along that sun line. When I talk about sun lines in my material, I have a kind of a different interpretation of how they function, but you'll see more about that in my workbooks, materials as you study with me. There's also a subscription service available through my store for $7 a month, where we're showing you how my classes are set up. And I'm walking you through, just like you have a bird's eye view into my curriculum. How about both right there? How's that? Now we're accessing that inner leg line and a little bit of the fan line of the foot, especially out towards the big toe. If I give you a little bit of slide towards the big toe, feels good? There we go. Much of the work, once you understand some of the basics, is very intuitive. You're just compressing, mobilizing, using some mixture of the two to be able to work with the client, create a little bit more ease of movement and lessening pain. Really great way to access the calves and the gastrocnemius right on the inside along the tibia. Come in and use a towel, and what I'll do is I'll place a towel over their hips and gluteals so that when I come in and use any hand pressure, they just feel comforted, covered, a little more safe and secure. I'm gonna bring myself up and I can find the greater trochanter of the femur. There's a bony knob right there on the hip. And right around that in the posterior is where the gluteal muscles begin. I'm gonna make little circles as I lean in and off, little crescent moon around that area. I'm also taking a look at her eyes just to see if the pressure is too much. Get a feel for this as you do it. You're feeling through soft tissue, gluteal muscles primarily. If I find a good spot, I can stack body weight. How's that right there?
Good.
Good spot. If I want to add some IT band in, I can. But a really nice way to access the gluteals from a different position that's mat-based, and always keeping in mind the comfort of the client that you're working on and the cultural context that we're working in. Beneath the cheekbone. When I'm accessing temporalis, working this way is really nice, feels really good, but I want to give you a different option where we're going to use a big, broad forearm. I'm going to bring the forearm in right above the ear. You tell me, Kristen, pressure to the posterior or pressure to the anterior?
Both feel good.
Both feel good. So I'm going to go to the center right there. Now, pressure up towards the top of the head or pressure down towards the feet?
Down towards the feet.
She's almost wiped out. I can tell just by her response. She had a hard time responding. Is the pressure good right there?
Perfect.
There we go. I'm just hanging out. My hand is relaxed, but I can access that area. In her case, what I'm going to do is have her arm bent and just to give a little traction through the upper back with it. I'm going to pull. How's that?
Good.
Yeah, it creates a little bit of space, rolls the shoulder blade back and down, lengthens a little bit of levator scapula. What about a little jostle?
It's good.
Or is it too tense, tender?
No, it's good.
There we go. When she gives me good feedback like that, I want to encourage that as a therapist. It increases the connection, the intimacy, and the capacity for better therapeutic outcomes by feeling that Kristen is working with me on the session. It's a really, really great way to access temporalis when somebody's on their side. You could do this just as easily on a mat or on a table. Position, how I'll typically come in and work on serratus anterior. I tend to use a very broad forearm for this. A pointy elbow often feels way too sharp. I tell people it feels like I'm being prison shanked, like between ribs. It's very unnerving. So when I use a big broad, oh, you're laughing at that?
Yes.
So I'm gonna sit in a way that feels comfortable to me. I could kneel high depending on the size of the client, but I'm gonna use a big broad forearm right along the side here at the ribs, just at the axillary border of the shoulder blade. How's that right there, Kristen?
Good.
Is it tender?
No.
Not tender, okay. Now, if I hook right here, tender at all?
No.
Still good? Okay. If I shear posterior or anterior to the front?
Anterior.
Or anterior? What do you think about there?
It's good.
Okay. What about a jostle? There we go. This is a really great way to access the area. It's soft and gentle to the clients. I often find that people have tension in serratus anterior, often called the boxer's muscle, because it protracts, it pulls the shoulder blade forward so you can deliver a strike. If you want to change the position of the shoulder itself, I'll often lift their arm and place it over mine. So now I have this little handle to be able to jostle and move here, right there. Up or down?
Up is fine.
Up is fine. Right there? Not too much?
No.
What about when I give you some pull here on the arm? To the posterior or to the anterior?
Posterior.
Little posterior? Right. What about jostle? There we go. This is a really effective way to be able to sit and hang out for maybe 5-10 minutes on each side. You can work the serratus along this axillary border all the way down the rib cage. Just make sure to communicate with the receiver as you go. You don't want it to feel painful, but it can feel intense. Serratus anterior will lead to a lot of shoulder problems. I think because as the shoulder blade pulls forward, it puts the shoulder joint in a different position in gravity so that they're overusing shoulder muscles to mobilize the arm. Into the deltoids, I've got her arm comfortably down by her side, And I'm going to pick which arm feels most comfortable for me to put a little pressure here. Kristen, you'd had an issue with your shoulder. If I put some pressure right there in the deltoid, it'll be okay?
Sure.
There we go. So I'm going to stack my body in a way that feels comfortable to me. Big, broad forearm. I'm going to grab right in there. A little bit more, I think, middle deltoid. So if I have pressure right there, not too much?
No.
Now, do you prefer to the back or to the front?
Whichever.
Whichever, okay. Usually when they don't have preference, I'll just go to the middle. Now, do you want down towards the elbow or up towards the head?
Up towards the head.
There we go, right there. How's that?
Good.
There we go. Now, to give a little bit of nuance here, what I'm going to do is I'm going to hold this hand where it's at, and then I'm going to give her a little bit of rotation. How's that?
Good.
Don't like that one as much as going the other way?
Yes.
It's tender.
Yes.
Okay. I'm using the hand to be able to mobilize the humerus and therefore the tissue underneath. How about right there? I can also give her a little bit of traction. Ooh. Really great, effective way to work on the deltoids while minimizing hand strain on myself. It's really great for clients. When I take that compression off, I often just kind of shake them out just to feel my way around the deltoid itself, see what's going on. I like jostling and mobilization because it feels like it wakes up the tissue and shakes out any lingering tension.